The Egyptian ambassador to Kenya is calling for stronger cooperation between Kenya and Egypt in the medical and trade sectors.
I'm here eventually to support the Egyptian companies working in the medical fields and trying to explore the Kenyan market. It is one of my major pillars working in the embassy to support the Egyptian companies and to try to help our Kenyan brothers and sisters to ameliorate the medical service here in Kenya. Egypt and Kenya are both members of the COMESA organization, and we are having a very good trade. Eventually, speaking about trade, you have to know that we are the second world importer of Kenyan tea. So Egypt is the second world importer of Kenyan tea, and we have a very good relation when it comes to the commerce and trade between the two countries.
Speaking during the ongoing World Health Expo in Nairobi, the envoy noted that there is growing demand in the Kenyan market for medical support, a move he says will foster collaboration between the two COMESA member states.
We belong to the same continent, we support each other, and we should be stronger together. We have a very high quality in medical equipment. We have a very high quality in pharmaceuticals. And the main issue here is at least look around. Don't go to your traditional sources. They might be more expensive, in some areas less advanced than Egypt. I know it is hard to get the new market in pharmaceutical for Egyptian companies, but we keep trying, and the Kenyan people will see themselves the quality of the Egyptian production in pharmaceuticals. They will see.
Meanwhile, REME-D CEO and founder Dr. Salma Tammam, the visionary behind Africa's first molecular diagnostics manufacturing plant, says it's time for Africa to believe in and invest in its own scientists.
We would like to push our products into the Kenyan market, especially that we're the only African manufacturer in the field of molecular diagnostics. So hopefully we are able, to push our products and change the narrative from Africa always needing to import products from the US and the EU and not generate our own. Before I start REME-D, I was a university professor, and shortage for COVID testing in Egypt was the main cause that, as an academic professor using government funding, we were able to locally produce COVID testing in Egypt. But after the pandemic has, calmed down, it has become very obvious that what we've seen during COVID is just as an example of what we could see given future pandemics or given what has happened now, cessation of international funding. So when we started developing tests for Africa, we wanted to look at African problems. So if you compare our products to the products that are available from the US or EU, 70% of our tests are room temperature stable, which means that you do not need to freeze them upon storage. You do not need cold chain logistics. And in countries where constant electrical supply is an issue, this is a very, very big plus that you can ship and store without freezing. The second thing, of course, is that the protocols are a lot shorter in time and are a lot simpler to use. We also produce small battery-operated equipment, so we allow, what we like to say is that we allow the decentralization of testing. Testing is often only available in central labs, which means that people have to travel for miles to access the test. But if we offer smaller machines that are battery-operated, then we bring the test to the patient and not the patient to the test. And of course, affordability. This is a local product that has been developed for local need, and we have developed a patented formula. So as an African manufacturer, we hold a US patent because our formula allows us to be extremely competitive in terms of pricing. And what we want to say that now a dollar goes a longer way. If funding was available, if you had $100,000 to test for 10,000 patients, using our products, $100,000 will test 400,000 patients.